What testing have you had before going on your antidepressant?
All right, bring it.
Millions of people are on antidepressants in the form of SSRIs, selective serotonin reuptake inhibitors. But do you know that your serotonin levels are actually low? And did you know that that can be tested for?
I see it's already been brought in. Look, it is true that we can test for serotonin levels in the blood, but this is to test for certain kinds of tumors, and particularly if you have heightened levels of serotonin. But let's give them a chance. What else have you got to say?
Many people go on SSRIs and actually see no relief whatsoever. Also, several people go on antidepressants and feel a lot worse because their serotonin levels are already good.
So this is a great example of stating a few true facts, but then coming to a bad conclusion. Because it is true that people who go on antidepressants don't always see benefit. We all know this, I think. But it has nothing to do with whether or not they had low serotonin levels in their blood prior to taking the medication. Because decades of research have continually shown that the relationship between blood levels of serotonin and depression is tenuous at best. And that's because the entire theory of depression or anxiety being caused by low levels of serotonin is flawed, and there is research showing that. I did some videos on these studies just a few months ago. Instead, the reality is we don't actually understand exactly how some of these medications help certain people and not others. But I can fairly confidently say it's not because their serotonin levels were already good, because the mechanisms of action of these medications are complex. And even if you have normal serotonin levels, that doesn't mean heightening them might not provide you with some relief. But again, let's give him a chance. What else has he got to say?
They go on this medication, which increases their serotonin levels, and they go into what's called serotonin syndrome.
So that is inaccurate and incredibly dangerous to be saying here on social media, especially as a chiropractor. Of course it's a chiropractor. Now, serotonin syndrome is a real thing. But the vast majority of cases are from a drug interaction, basically taking two different drugs that both increase serotonin levels at the same time. A really common example might be that you're taking Prozac and then you also take, say, your migraine medication that's a triptan. And yes, it's possible to get serotonin syndrome from just one medication, but it's very rare because you'd really have to ramp the dose up. But that's a conversation between you and your medical doctor. Physician, not a chiropractor on TikTok trying to sell you supplements and extra testing you don't need. And this kind of dangerous fear-mongering is going to take people who are getting benefit from their medication to potentially stop taking it, even though they don't have serotonin syndrome and certainly don't need to pay out of pocket for your blood test that you offer at your wellness clinic. I'd say do better, but based on your social media account, you enjoy frequently speaking outside of your scope of practice.